Hello, hi everybody. It's Victor here. I'm with my dear friend Antonio once again. Hi,
Hi
Antonio.
everyone. Hi everyone.
It's good to have him back here with me. Um, this live is being recorded, so you will be able to have access to the whole content later. I know it's this is a topic that you guys have been asking about, so we you will be able to watch it later. Okay, just Antonio will rejoin. There's some issue here. Just 1 second. Okay, I will just wait for a while until we establish connection again with Antonio. Hello, Antonio. Here you are.
Sorry guys, I don't know what happened.
No, no worries. I guess Lila. She for some reason this live is not being broadcasted to our group, but we will be able to later on. Can use the record and then publish on our Facebook group. So, but for now, so it's 6 p.m. and let's start with the questions. And the reason we are having this Facebook Live is because we did not have enough time last time to go over all of the questions. They were many, and we will try to at least summarize some points uh, that were asked last on our last webinar. Okay, so let me open here the file. Okay, so yeah, many questions, which is amazing. And so to start, most of the questions they are addressed to Antonio. So let's start here with the one that was made by Carlos, and he asks this, Antonio. I thought the public system was only for residents. Don't immigrants, just like American people, need private health insurance until they become residents? So he wants to know if the public healthcare system is only for residents or for everybody.
I think it depends what we are looking at. I'm not really sure what are the requirements from a visa application perspective. I'm not sure if that is mandatory or not. But let's say that they are here in the country as a tourist, and if they need medical care, they are going to be always entitled to urgent care. So if they have, let's say, an acute ear infection, or if they have an acute, like an accident or something, if they present to the emergency room, they will be seen no matter what. The system is universal and tendenциally free, meaning that they would be paying as we as a normal citizen would be benefiting from the system. Uh, if they wanted to have like a prescription refill or like a vaccination shot or something, that is a completely different game, and they will probably not be having access to that. But anything that is urgent and that's cannot wait, they would be able to access it.
Perfect. I know that there's some countries where you can find some agreements between these countries and Portugal, and they have easier access to healthcare system, just like Brazil, for example. I know that there's some ways you can have more access, but uh, overall, that's
But it will be, even though it probably will be most likely still on an
yeah,
emergency
yeah,
basis. Let's say that someone here, like someone from another European country, and they came and they got sick, or if they want to have a health care, if they have the European health card, then that will change things slightly. They should be able to access routine care using their European health card, but that is part of that applies to any other European country as well. If it's someone coming from outside the EU, then they would still be able to access it on an emergency basis.
of course. And of course, needless to say that with uh, Algarve MedAssist, that being resident or not, I don't know if there is some kind of difference.
No, for us, of course not. I mean, for us, who and anyone that comes to us, we will, of course, would try to help them and guide them in the best way. If they wanted a private an appointment or a private prescription, of course, we can facilitate that, and the same as any other uh, private hospital or clinic that they see on the high street, you will always be seen. It is a matter of using of course, it's a private service, and they will pay the charge that it applies to that intervention. And for us, and that's kind of like where we, being Algarve MedAssist, we can provide that guidance, because we have our phone number is widely available, our emails are widely available, we are accessible through our website on WhatsApp or on Facebook, so they can easily send us a message, and we can try to guide that person that way. If you are coming via Viv Europe, let us know, so that of course we can as well have a better understanding what is your needs, what are your background, and of course that can like help us as well in how we treat that case.
Thank you so much, Antonio. So next one, there are many questions related to the provisional utent number. So there's maybe people are not aware what is the difference between the provisional and the definitive one. Do you want to address this topic, Antonio?
I think, yeah, of course. I think the question here is, how did they get a temporary utility number? Um, I really only heard of the temporary ones during the pandemic, because the services were giving this utility number for so that people were kind of like had a temporary registration on the systems, so that they can track that they given that vaccine to that person. But then I actually had a client of mine who had one of those. Then she actually, but she was here for a good few years, but she never really sorted out her paperwork. So she wouldn't have the vaccine. But then, although she was here, when she started needing prescriptions and needed to be admitted, that number, it was showing as invalid. So again, if you have a temporary number, it is probably was created for a specific need, and then it should be verified later on to see what is happening, and what needs to be done to accomplish that. It could be because sometimes you are missing your proof of address. In this specific case, I can remember that the client was she had a house somewhere in here in the Algarve, and she needed to go to the local junta de freguesia, so the local borough, to get like a proof of address stamped, and that's what she never did. So it never really went on to being effective. So sometimes it's these small things that can be not are not correct, and that are missing. So to make it as a simple process, um, and that's where it goes wrong. So either you try to find out what's going on. If not, we can as well try to have a look as well from our side, speak to local services, and see if what we can find with that number. So this is a service that we can try to help with.
That's amazing. I remember that in my case, when I came to Portugal 6 years ago, um, I don't recall the reason, but I got the temporary one. I guess in that time it was because I had the visa, so I was able to move to Portugal, but I still didn't have the permit. So the document that allows me to live here long term. So there was this discrepancy, and they gave me a temporary one that I later on I had to make it a definitive one. So I guess it's
Yeah,
like
and
this kind of
then yeah, it's probably kind of like that. That's the same reason, like similar situation with what we had with the pandemic, or sometimes people had to go to the emergency room for some reason, and they created for you there. But then it's just for the effect of that admission, and then it doesn't really succeed. Um, as well, sometimes you have that number, but then when you are going to go and have prescriptions, or if the doctor wants to issue prescriptions, the number doesn't work, and that's when you realize that oh, my I my details are not,
yeah.
um, my credentials in the system are not correct, so it needs to be rectified. And it's something that if you are allowed to, if you are entitled to it, it should be fixed.
Amazing. That's perfect. That's very important information. Sometimes they think that they have the permanent one, but it's just the temporary, just to make sure which one you have, not to make any mistake. And also, I have here one question from Loretta, and I recall that this was a topic that we did not address well enough. That's related to Portuguese healthcare structure. That's her question. What about medical specialists, such as orthopedic or prosthetic services? How do you
Hmm.
find or access these services? Would you need to be referred by your family doctor? So, going to specialists, I guess this is an important topic. And
Yes, in certain countries, you only can have access to a specialist if you have a referral letter, and the referral letter usually is given by your family doctor. So I think that's kind of like where I'm coming from on with this question. Here in Portugal, we have a very active private system, and you don't really need a referral letter from a specialist. Sorry, from your family doctor. It is best practice. It is advisable because there's a lot of things that the family doctor can do himself, and he only should be escalating to the specialist doctors when there is a need. Now, if you are already being followed up with a specialist because of reason A, B, or C, you should be able to, when you arrive, just to self-refer, to identify a provider and a specialist, and just self-refer to that specialist, and without bypassing actually the role of the your family doctor. So it shouldn't be. You don't need. He does not need to be mandated by him every time.
yeah, perfect. Yeah, I guess this is a
And
very
as well, I
clever
mean that's kind of
system.
like and that's kind of like another system service where we as well we can help you with finding that provider and also setting up that appointment for you. To make it easier. So kind of like when you arrive, you are kind of like at the beginning trying to understand all these sort of things, so we can talk you through the process and guide you in that way.
That's very useful. I can, from my personal experience, I know that when you arrive to Portugal, and if I was like hoping that I would not get sick because I would not know what to do. So hopefully it went well for me.
Well, you didn't know us very well at the time, so otherwise we would have guided you on the right way.
Exactly, exactly. There are also many questions about prescriptions, Antonio. So just to go over some of them. So Stephen asks if it's difficult to get a prescription medications. How difficult it is to get prescription medications? Are prescriptions covered in the public sector? So do you
Yeah.
want to go over this topic?
Yeah, so any doctor can give you a prescription, either if he's in the private sector or in the public sector. It doesn't really matter because the doctor will have the authority to make that prescription, and it will be down to his judgment and his decision to prescribe a certain medicine. Now, how that medicine will be that a prescription will be issued, then depends on different ways. If you have a Utente number, it's the easiest way because the doctor will has a software where he can put your utility number in, and then that will bring up your details, and you actually will get a prescription on your either via email or via a text message. It's kind of like a huge long code. You present yourself to the pharmacy, and they can see it on their system. They can see the back end of that prescription, and they can give you the medicine. If it is something again, if you are entitled to NHS to our public health system, those medicines will have a different price as well because especially if you're already a resident here, you would have the same benefits as we do as Portuguese people. You would have that as well. So the government will contribute towards those medicines, and the price will be different. Just to give you an example, and one of the ones that actually is kind of like a bit more alarming in terms of the price change. Probably some of our audience will be on apixabanone, for example. So it's an anticoagulant. Um, the normal price for a box of that medicine, I think for the 10 milligrams, it's 70 euros, just a box. But if you have the prescription and you are covered under the national health system, that will bring it down to 20 euros. So it is a huge difference. And of course, if you are entitled to it, it's worth having it. Um, the other way as well for the prescriptions is sometimes the doctors will just give you that medicine, the kind of like a slip, and you just present that to the pharmacy as well, and it's also valid as long as it's has been filled in correctly and has the stamp of the like they have like a seal that they stick to it, and you can then go to the pharmacy with that paper. That should as well be good to go. So again, the medicines are available. It's easy to get a prescription as long as you have an appointment. Any doctor should be able to give you a prescription, and then it's just a matter of like following whatever process was given to you at that time. One thing to bear in mind here is, let's say that you are on long-term medicines, and you are thinking that you are going to get that same medicine here. It may not happen because the active ingredient will be the same, just the name will be different. So bear that in mind. And sometimes as well, they can come up with slightly different concentrations. Um, for example, aspirin, which is a simple one. Some countries use 75 milligrams as just like your normal daily aspirin. Other ones will have 81 milligrams. Here in Portugal, we actually give 100 milligrams. So just these small nuances that it's important to be aware of, and so that you don't get surprised the first time that you go to the pharmacy and try to get them.
I guess, Antonio, I don't know if I'm correct in saying that this prescriptions will be registered in your registry here in Portugal. You know your history here in Portugal, and any other doctor will be able to see your previous prescriptions. Is that it?
If you have the Utente number,
Yes.
so all the prescriptions, the medicines were prescribed under that number, they will be there. So the doctor, he may not. Let's say if you are usually going to your general doctor that is in the public system, they of course they have their internal data file, and of course all your history will be there. But let's say that you decide one day to go to a private doctor, of course he will not have all that structured information because it doesn't bypass from the public to the private sector. Now, in terms of medicines, if they put your utility number in, they should be able to see the history of medicines that were prescribed to you and renew it, for example, on that basis. So on that sense, they should be able to see it.
Yeah, this is very advanced in a way. I remember in Brazil, we uh, of course there is not so much of a well structured process like this where you can just have a certificate that can be used as a prescription. There, the doctor will sign will point out the medications and everything, and there was always that struggle trying to understand what the doctors had written in the paper. So there's not this
That
issue here.
still that still happens as well. Don't take me wrong.
Yeah.
Even yesterday I was at the pharmacy myself for a client, and I could see another client and the pharmacist trying to, what is this written here? I have no idea. And they asked me, what do you think it's here? I said something, and then between them they had all different opinions. So of course they had to end up calling the doctor and say, look, what do you mean really, and clarify. So that's the big advantage of having the electronic prescriptions. And again, they can issue electronic prescriptions even without having the utility number. It just means that they have to type out all your details to come through. One
Amazing.
thing to bear in mind is, depending on the medicines, they may require different levels of, let's say, authority. So if you are on some sort of like a psychoactive medicine, or if you are on some sort of morphine base drug, or fentanyl patches, things like that, they need to they need to the prescriptions are slightly different, and they will ask you to leave your ID at the, like, a copy, show your ID, so to make sure that the patient and the medicine are correct. Of course, if you are the patient, you cannot go to the pharmacy. There is ways as well to bypass that as well. So bear in mind, I personally have shown many times my ID at the pharmacy when I'm picking up medicines for my clients. So there is ways around it. But don't be surprised if they ask you for some more information, because it's just the kind of like the security levels that they need to go through.
Amazing. Thank you. We are coming to an end. We are trying to put together some questions that have similar topics. And
There is one that actually I probably can contribute with that. This was someone asking that they were a type 1 diabetic, and what was the what was the process? Let me see if I can find that question.
I guess it's
I think it's quite
also
at the beginning.
yeah.
Yeah.
Uh,
So the question was, what insurance is required? How to navigate the public and private health, especially if you have long-term conditions. So in the case of diabetes, because this was the example of this person, I think it was, yeah, I don't see the name, but yeah, was someone who's type 1 diabetic. Um, if you are already fully registered, you are a resident in Portugal, for certain medicines, for certain conditions, you have higher benefits, let's say. So if you are a diabetic person, doesn't matter type 1, type 2, as long as you've been diagnosed as diabetic by your doctor, that needs to go then and be associated with your Utente number. But what that means is that your medicines for diabetes tends to be either free or at a very low cost. So, for example, your insulin and your the needles, for example, will be free of charge. The strips for measuring your blood sugar, that will also have a cost associated with it. But again, like 50 strips can cost you 18 euros. With the prescription, it will then come down to €2, and that should give you, for at least for a month at least. So there is ways, there is some benefits to make sure that they are declared, so that when you have a prescription issued, that is kind of like already taken care of. This same applies for, even if you are coming from within the EU zone. If you have the European Health Card, that still gives you the same benefit, because what that card does is it gives you the same benefits as um, a Portuguese national in Portugal would have access to. So that would apply as long as you have the EHE card, or the European Health Card, as we say.
Perfect. And changing a little bit the topic, Antonio, about they do ask many questions about the emergency uh, situation here in Portugal. How is it handled in Portugal? Do we have to schedule in an emergency? How things are handled in emergencies? Can you talk a little bit about this
Yeah.
topic?
Yeah, let me just get my draft answer up. So
Yeah.
the question was, do you have if you have if you have an emergency, do you need to schedule? Of course not. It's an emergency. We do not schedule. Now, just to give you an idea of how the system is set up, So yeah, you have the private, you have the public. If you want to go private, just make your way to the hospital, and that's it. Some hospitals already have kind of like a triage system, which you can call up, and they will triage and help you decide if it's urgent or not. That is a bit of also the way that we operate as well. So if you're not sure, you can always ask to speak to our team, and we will as well kind of like give you that guidance on terms of what will be best. Either if it's something that sounds really catastrophic, you probably already know yourself. You would just be going to the hospital directly. If not, we can try to help you to access the care that you need. In general terms, what the local population is kind of like instructed to do is there is different levels. If you have, let's say, not sure what's going on, you have like a help advice line, which is what we call Saúde 24, meaning health 24 hours. So it's kind of like a general number for free, and you can call them up. They will triage you, and they will help you to decide what to do. If they feel that it's out of their scope, they will activate the emergency services right away, or they will say, actually, just make your way to the hospital, and they actually are supposed to notify the hospital beforehand that you are coming as per their advice to be seen. Apparently, there is if you use this number, you do not need to pay what we call the moderation tax. But on the other hand, recently there was a report saying that that hasn't been working very well. But just for you to be aware of. But let's say that you have a real emergency, chest pain, suspecting a stroke, you had an accident, something serious, the best thing to do is what you need to do is call 112. That is the European helpline. Even if you called 911, it also will work as well and will direct you to the emergency services, and they will. Usually, how it works is it is a policeman that picks up the phone. You just need to say, I have a medical emergency, because they ask you, what is it? Is it hospital? Is it health, police, or firemen? You just need to say health, and you will be put through to the health service, and they will do a triage to you to determine and give you instructions on what to do. Either they are quite thorough in their questioning, just to understand exactly what's going on, and according to what it is, they will then dispatch whatever means are required, either just sending an ambulance to go and pick you up, or actually, if you're talking about kind of like potential heart attack or cardiac arrest, whatever it is, they will send the right teams to meet you. Bear in mind that the response times may vary as well, depending where you are in the country. If you are in Lisbon or Porto, the answer, of course, is quick because there is more resources there. If you are more inland, um, the response time can be more delayed. So bear that in mind and factor in those timings when you need to call for help. So don't leave it till the last minute. Call when you're suspect that something is not going well.
And I guess, Antonio, maybe I'm wrong, but in terms of emergency, do I need to go to the emergency that's linked to my address, or I'm free to choose any other hospital in case of an emergency? Emergency.
So, but are you thinking of going to, if you're going private, you can choose, of course, the hospital that you want to go to. Um, like for example, I'm here in Lole. I have a hospital here just next door to me, but I may think actually because of this or that situation, I want to go to Luzia de Albufeira, or I want to go to the HPA near the airport. It's up to me to decide what I want, where I choose to go. If you call the public services, then they will detect where you go. So if you call 112, and if they decide that you need to go to the hospital, they will pick you up and they will take you to the hospital that is able to cater for your needs at that time.
I see. Perfect. Perfect. Thank you, Antonio. Really. We are coming to an end. Usually we take around 30 minutes to cover this Facebook Live. So we are quite on time. So let's try to get these last three ones. So there is one from Lindsay, and she asked if it's the generally a best practice or recommended that Portuguese residents have a public and private healthcare plans.
There is no requirement for a Portuguese national or for a resident. I'm not talking about any requirements that may exist because of their visa application. But besides that, there is no requirement for you to have a private health insurance. Um, now, what people in generally, and that has we have seen that as well, is that more and more people are adhering to private services and to private health insurances because there is this feeling that the public health system is very stretched. It doesn't answer your needs on time and in a way that you would like to or you would expect, similar to back in your own countries. So that's why people would go for the private health insurance because it gives you a quicker access to care, and this is especially around specialist care. If you look at it, currently to wait for a dermatology appointment um, in the private sector, you probably are waiting a good few months before you can actually find one near you. If you are talking about in the public system, you're probably talking at least a year. So similar to ophthalmology or cataract surgery, hip surgery, all these sort of things, they are taking quite a long time. There's big efforts to try to implement measures to reduce these waiting times and these waiting lists, but the reality is that people still prefer to go to the through the private route. Of course, they'll have to push pay a bit out of their pocket, but with the health insurance, it will bring it down a bit, so you don't pay the full amount as if you were paying privately. The general consensus, anyway, is that consensus is the reality is that the private care is still very much affordable when you compare it with other countries in Europe and for example with the US, it is um, it is a huge difference. So again, just going back to the question, people do tend to have private insurances here in Portugal, but it's more for um, peace of mind and for that extra reassurance. Um, Talking about my our example, we have a young child, and one of the reasons why we put him right away on the private health insurance on our private plans was that we could have access to a pediatrician whenever needed. If you go through the public system, you are going to be dealing with your family doctor that is specialized in family medicine. He knows how to look after a kid, don't take me wrong, but there will be certain things that belong to the pediatric world that we would rather discuss with the pediatrician. So this is just an example of where having that option to choose from one plan to another is nice.
Yeah, yeah, that's really nice. You know, being Brazilian and living there for so long, I know that it's kind of mandatory for us to have private healthcare insurance because the public service is not good at all. But here, despite not being mandatory, there are certainly some benefits for having. Yeah,
Yeah, I mean, here the country has been built on a very strong on the idea of a very strong public health system that
yeah,
would cater for all your needs. And we cannot forget as well is that a lot of times the private hospital will rely on the public hospital as well. It is not unheard that someone is in a private hospital and had to be transferred to a private hospital because there wasn't the right specialist at that time of the night. For example, they have all the specialties during the day, but there may be one day that they don't have that specific need that you have, and they will then refer you to the public system. So that is that the public system is kind of like always the backup plan. They never close. They always have their options, and if you don't have it locally, they will help you find a way to get you through to whoever that person is,
Yeah.
that specialist is.
And now Bruce, he asks about the dental care. How does dental care fit in the system?
It's quite simple. It's just in the private sector. There is no real dental care in um, in the um, in the public services. So
Yeah.
everything tends to be done through private clinics that you can find on the high street. Um, then again, it comes down to a matter of choice and a matter of preference, who you bound with and who you like. You see they see you once. If they sound nice to you, you may come back, but you also can choose and go elsewhere. Um, the costs for our standards in Portugal, it tends to be quite pricey. There is some insurances that will give you some sort of contribution towards dental care on your insurance plan. But again, there is no real insurance plan to cover all your dental needs. There will be always a portion that you will have to pay out of your own pocket as well. So bear that in mind. But again, comparing with other countries, it's still very affordable.
Yeah, I agree. And okay, moving to the last one from Lillian. So she has a special situation, such as many expats here that comes with pets. So she asks if you live alone, have a pet, and have to stay in the hospital, can you help with finding someone to care for your pets while you are away? Very specific.
Yeah, and I can see the concern that Lillian may have because it's something that I wouldn't say it happens every day, but it does happen quite often. Um, so what would if they were going to be she was going to be with us, that would be one of the questions that we would ask. Do you have any dependents, being person or any pets that need to look after in case there was some sort of concerns? Um, if we didn't know anything in that area, we probably would try to look for that option to see if there was someone in that area to at least have a connection. It is not something that we have like a robust database with those details, but certainly if there is a specific concern that we see that it may be coming up, we would certainly try to our best to find that. What I've seen in other cases is that what we do is as we get like a carer to come in and help the client with their day-to-day needs, we would at least make sure that someone goes in to look after the animals and make sure that they are fed and looked after during their absence. So that is kind of like where when we get a client on board, we try to go through all these different dimensions just to make sure that we have an idea what may be their potential needs and how we can cater for them. An option would be, as I said, someone from outside to go in and help them. Another option would be sometimes like the pet hotels that we probably can try to put them for a few days. So it will be something that needs to be looked at on a case by case basis.
Amazing. Thank you, Antonio. And of course, many people also ask us how they can engage with Algarve MedAssist. Is there a specific way? Just let us know.
Yeah, I mean, as I said last time, I mean, we left our email, and actually, thanks for those potential um, candidates or clients that have already approached. I'm more than happy to set up a quick call with any of you just to go through any specific questions that you may have. If you go on our website as well, you can actually book some appointments for free with us as well. Feel free to pick up a time and book a session. It will be with myself, so we can go in through any specific questions that you may have and help that transition into the Portuguese way of life to make that as smooth as possible. So we will be more than happy to be part of that journey and to be by your side to with your needs.
Thank you so much, Antonio, again. So we were able to cover all of the questions, and always nice having you with me here, talking to the public, and really amazed at being here with
No,
you.
thank you so much for having us, and as well, I mean, the offer is there, so feel free to either yourself or any clients that want to know a bit more about anything more specific. As long as we know, and I'm more than happy to share that information.
Thank you, guys. Have a wonderful evening. See you.
Well, see you. Boa tarde. Até à próxima.
Boa tarde.